Laminitis is a disease affecting horses' feet, often leading to pain and lameness. Within the hoof, the laminae, which are these soft tissue structures attaching the pedal bone to the hoof wall, become inflamed. And it's that inflammation that causes extreme pain and instability of the pedal bone. And in some severe cases, there can be a complete rotation of the pedal bone from the hoof wall. Symptoms of laminitis vary for every horse, but they may include lameness, heat from the hoof wall and coronary band, reluctance to lift the feet, increased periods of laying down, sensitive soles when your farrier applies hoof testers, a rapid and strong digital pulse, and a laminitic stance where the horse leans back, transferring its weight onto its hind feet to relieve pressure on those front feet, which are more commonly affected by laminitis. Laminitis can be triggered by a variety of metabolic or physical causes in any horse. Nutritional cues such as obesity, overfeeding or high levels of starch and protein in the hind gut are not uncommon causes. Laminitis can also be hormone related. Various carbohydrate metabolism disorders, for example Cushing's disease or equine metabolic syndrome, can predispose horses to the condition. Other causes have also been identified, including drug-induced laminitis and physical trauma to the hoof, amongst others. Obesity and overfeeding are the most common high-risk situations which lead to laminitis. So keeping your horse at his ideal weight and feeding him correctly are vital. Exercise plays an important role in weight loss alongside the correct diet. It's been reported that the total daily intake of starch and sugars shouldn't exceed 20% of the feed ration in normal healthy horses. For a laminitic, the daily intake of starch and sugars should be reduced to 10%. It's also important not to oversupply protein, as this is an additional factor implicated in laminitics. Not only do you need to consider hard feed, but also grazing and forage. Speedi-beet and fibre-beet provide a safe fibre source for laminitics, as they're very low in starch and sugars. When fed with a vitamin and mineral supplement or a low-calorie balancer, they provide a balanced diet alongside added roughage. For a laminitic, this is usually soaked hay or a suitable chaff and restricted grazing. For laminitics requiring extra energy and condition, oil can be added to feeds. Managing laminitis requires careful planning and also ongoing support from a nutritionist, vet and farrier. If you suspect your horse has laminitis, seek veterinary attention immediately. You can find laminitis information and advice at britishhorsefeeds.com.